Welcome to Zcast, everyone. I'm Kerravala from ZK Research, and I'm here in San Diego at Cisco Partner Summit 2025 with Grady Nichols, Senior Director of IT for Mercy Ships, and Rob Kim, CTO of Presidio. I'm really excited to talk to you at the Partner Summit, but we do happen to have a customer here, so that's good. Grady, why don't we just start with an intro on yourself and what Mercy Ships does?
I'm Grady Nichols, Senior Director of IT Operations for Mercy Ships. Mercy Ships, we provide, we have 2 hospital vessels where we serve the low income of Africa. We provide free surgeries to those less fortunate and those that would not be able to get it.
Yeah, you're one of those organizations that's using technology to do good.
Yes, sir.
Yeah, and Rob, you've been on with me before, but just a quick reminder who Presidio is and your role there.
Yeah, so Rob Kim, Chief Technology Officer at Presidio. Been here now 9 years. Presidio, we're a global digital solutions provider focused on delivering foundational IT services around modernizing infrastructure platforms, as well as how to use it. So building use cases through modernizing data and applications.
Yeah, and Grady, you just did a session with us analysts and press. That was great to hear. You're actually going through the process of modernizing the ships that you use for the service you provide. What's that like? It's like a hospital on a ship, right? What's that modernization process like?
Unique to say the least. I think for us, it's not only just a hospital vessel, but we refer to them as like floating cities, like I was talking about earlier. They're not just a vessel that provides surgeries. They're a vessel that house over 800 something people, families that care that come out. So it's a unique experience to be able to modernize that technology to operate across all those platforms, from marine operations to our full-blown hospital staff, hospitality such as a cruise liner, food services, all the logistics that go in there. I think it's a unique experience for us to be able to do all that.
Yeah, well, certainly. And so as you're going through this process of modernizing, there's a lot of new technology out there. Obviously there's AI, but if you just look at the innovation of the show, right, there's been so much innovation come out in the tech industry lately. What are some of the key things you're thinking about as to make sure that this modernization process you're going through now actually supports whatever it is you want to do for the next 3-5 years?
I think for us, modernization is also, I think it needs to fit in our environment, in our unique experience, and how do we utilize it on the ship. We're not necessarily in the environment having high bandwidth. We have a lot high latency issues. So teaming up with Presidio to help kind of engineer how we best bring the new modern technology to, and how it best suits our needs to provide for our hospital staff, our surgeons, and everything, to be able to update to that, but be able to operate still, autonomously, operate in the world how we do with our environment, considering all the latency and other issues we have in these countries we provide. So there's just a unique thing we do.
Yeah, and is AI part of the modernization process, or is that still TBD?
AI is definitely in there. I think some of it is, we also have to have the infrastructure and the things to support it. Yeah. But I think we are using it through many other different means, from how that we do our normal day-to-day operations to how doctors can do and utilize things to have faster results. They need to be able to come out, be able to access patient data, not be able to do things themselves. It kind of helps them speed that up, and teaming up with them and other people has helped us out. But
yeah. And Rob, why were you? And what's the role you're playing within this?
Yeah. Well, first off, you talked about the unique aspect of these floating cities, right? And then you think about not only the surgical care that you're providing these the patients and the constituents, but also the other parts of the mission, like education training, so that when the doctors leave, the local medical teams have enough training that they can continue to serve their people. And so if you think about the places that they're docking these ships, the quality of power that you have, the environmentals around that, typically when you're building out data centers, where you're building it out tends to have is less of a factor in terms of constraint than you have with this essentially floating Faraday cage. And so a lot of that consideration has to go into not only how we architect, but also potentially provide resiliency. So whether it's dual data center setups and what we're doing to help control power environmentals, those all factor into it. You mentioned AI. There's obviously a lot of the surgical instruments and imaging systems already have deterministic AI within them, right, for image classification and things of that sort. But when you start to look at application of more generative AI for things like ambient digital scribe, we now have to figure out how do we take, these GPU clusters that run hot, require a lot of power, and figure out how to fit them in within a vessel like that. And so these are all things that we're working with the Mercy Ships teams to figure out how we're going to architect and design.
So for you as the partner, what's this process been like? Because it's not like, I don't imagine Presidio, while you're global and you've got, you do business all kinds of verticals, I doubt you have a floating city practice, right? And so how did you go through the process of understanding the uniqueness of this environment?
Well, first off, we're very fortunate. We've worked with Mercy Ships for over 10 years at this point, and so all the way back to the first vessel. And so we talked a little bit about it on stage. First off, you run into the challenges, as you'd imagine, but having gone through the build-outs for the initial two certainly gives us a lot better of a blueprint to follow on. Now, obviously, we're talking about modernization of the technology itself, but generally speaking, things require less power and things are smaller. And so it benefits us as we look at modernizing with new technologies that Cisco is putting out.
Yeah, and so how long does the process of modernizing a ship take?
Wow, how long was Africa? How long was Global Mercy?
Global Mercy, I think, is a unique thing that happened during the COVID, but that took almost 7 years to get in. We are in the process of building our second ship, and we just started steel cutting as of the 29th of October, and we're hoping to have that floating and in operation by March of 2028.
So my question there is, since and I imagine it would be something like that, the technology from the start of the project changes so much to the end of the project, so you could finish ship 1, but it's not like ship 2 is going to be the same, right?
Yeah.
Not at all. I think that's kind of a unique experience where we try to keep up as much as we can, and we working with Presidio, we've been able to kind of somewhat engineer how we want the vessel to look. We kind of wait till I guess you could say that not the last minute, to the timing frame that we want to do to order the equipment, and how we implement it during phases of what we call equipping when it's time to come. So by the time we get to the ship being built and time we equip it, it's not much time between the equipping phase and the actual first day of operation. So it kind of hopefully will help us dwindle down that latency, that gap there between engineering something and by the time it comes in operations, it's already time to be replaced.
Yeah, and since we are at Partner Summit, right, it's a Cisco show, obviously this is used to highlight a lot of the new technology that Cisco's one of its partners. And so specifically with the infrastructure on the Mercy ships, what Cisco technology is being used there, and can you give me just an overview of the architecture and the environment?
So I think Cisco's like I said earlier in the other podcast, Cisco is the backbone of our infrastructure there on the ship. Every single device, everything from the Wi-Fi to the OR rooms, the access cameras connect to some Cisco. We have IDFs throughout the vessel, so they're all switch stacks. And somehow, some way, every piece of device connects to some Cisco technology piece there. We have 3 on-prem call management VoIP systems that run through our Cisco devices there. So I think that's
you have
16.
3 call managers on one ship.
Each location. No, not one ship. So each location. So we have 2 vessels and one thing. So we have 3 different separate instances of that. So this ties ever integrated through it. So it's all ties together through many different devices and 1,600, I think, different phone systems. I can't tell you how many switches now we currently have across the vessel.
Yeah, do you know?
Yeah, telepresence requirements, obviously, especially for a lot of the telemedicine, especially when you're doing, multiple doctors, remote diagnosis. So that's obviously pretty critical. Server technology and compute, it's all,
Yeah, and so, when I talk to a lot of the partners, they're shifting, and customers, they're shifting to really outcome-based, projects. And so, what were the key outcomes you were looking for? Like, if I think about the pre-modern ship and the post-modern ship, what are the kinds of things a clinician or a doctor might be able to do tomorrow that they can't do today?
I think for us, having modern technology on the vessel, modern ORs, so when they leave their hospital, wherever their local country is they come from, to volunteer for us, it doesn't look much different from their ORs and their ability to do that at their own local hospital. I think beforehand, a lot of our ships were based off donations of how we did the technology. So the technology now is like purposely built, purposely designed to fit and look and basically resemble a actual hospital, modern hospital room that they're actually used to. So I think that's kind of what we're trying to go
and
for.
if you think about other specialty areas, right, in order to be able to cover the gambit of different surgeries that you could provide, that the first piece of that from a remote diagnosis standpoint is the ability to be able to consult other doctors. But with robotics technology getting better, the idea of being able to do remote-based surgery, which is now starting in its infancy, that being able to apply that technology would be something. It also could potentially allow you to be able to get more volunteer surgeons and doctors, right? Because now they don't necessarily have to be on site. The simulation testing that they provide for training is huge, because that's a way that you can provide even more benefits for the local community, because you're training their medical teams in these simulated surgical rooms, and that allows them to be able to take that knowledge back to their village and then their towns. And so, the tremendous amount of technology that's required in order to be able to provide that capability. And so those are certainly other areas where we think we're going to make more investment.
Now, as for the person who's responsible for the technology, right? I think one area Cisco's made a lot of progress in is in AI for operations and for IT troubleshooting, things like that. Is this something you're thinking about? How to use it to be able to better manage remotely, proactively support things like that?
Yes, we're always looking at new technology and new things, and I think that
you got to have a small staff too, right?
We do. I think that's the key thing about the staff that we have, and I think that's kind of interesting that we can kind of talk about it here. Most of our staff is volunteer staff that comes to the vessel and helps out. So our IT teams aboard the vessel is 100% volunteer staff. So what that means is they volunteer for 2 weeks up to 2 years, depending on that. So our rotation of IT staff is on the vessels is pretty fluent. So keeping up with we have a small staff that's remote workers from Texas that support the guy to get in there. So it's key to team up with expertise that knows about new emerging technologies and helps us kind of decide which ones best suit our needs, which ones do not suit our needs at all, and kind of steer us and help us kind of design and architect based off that new incoming things.
Yeah, a lot of people talk about how partners, we act as trusted advisors, but honestly, we feel like we're part of the Mercy Ships team. So wherever we can fill gaps, whether it's in knowledge or enablement, as well as, certainly what we do from a design and deployment standpoint.
And does AI help you be able to manage and help them more remotely?
Certainly in the future, as we start to take a look at, the various different offerings that we're seeing, we think Cisco IQ is going to have a big play in what we provide, not only in terms of managing some of the entitlements from cost efficiency perspective, but then also being able to pull in telemetry data and seeing if there's even more ways we can optimize the limited bandwidth that we can provide, given obviously the remote nature of the boats themselves.
Yeah, I'm glad you brought that up, because I was going to ask you, from the payload of announcements made here, was there anything that caught your eye that you thought would be useful for Mercy?
Well, I think you talked about some of the things around Unified Branch. I think that there is applicability there. So we need to figure out where best we can do it, just in terms of being more purpose-built. I do think that obviously the work that they've been doing around GPU clustering, and whether it's now you have 880 that supports BG 300s, and obviously what we have with 885, being able to provide privatized generative AI on board the ships, and again, localizing the services so that you're limiting the amount of transmission that you actually have to have out there, and really saving that for things that are much more medically necessary.
Yeah, I guess ideally you would, anything you can do local, you would want to do
100%.
Yeah.
100%.
Yeah. And so what does that mean from a data perspective for you, Grady? You got to be generating just a ton of data on board the ship now.
We do. I think we kind of limit. We have 2 data centers per each vessel, so the data centers kind of man it. We kind of
come see one of these.
Yeah, it's a unique thing in how we do it. It's definitely a lot of data that goes across that we have to do, and I think bandwidth is one of our is one of our key things. Is to keep everyone connected. Not only keep them connected to do their day-to-day jobs, but we talked about families live there. They have to do the same things you do at home with your wife and kids when you get back to watch movies, do the same thing, keep it with social media. And like we said, a lot of them are volunteers. So being there, they have their own donors and stuff to support them to be there. So be able to get that out, get their message out, what they're doing there, and ensure that. And so they have their connection with the real world is key. And it's a pretty significant amount of data that's going there. I think our data centers and our team is very unique and capable, using their experience along with everyone else to actually provide that for our people.
Yeah, it's some of the work that we've done because we have a pretty large entertainment and media vertical industry capability. There's obviously video feeds that are all around the ship, but our ability to be able to cut the video up and present it in a way into these short clips that we can use for social media. These are all ways that we can help increase donations, increase the loyalty to obviously Mercy Ships as an association. So any way that we can implement technology to help there, and obviously a lot of that's going to be AI based.
Yeah, and talk about the scale of how many patients do you treat?
That ranges significantly. I wish I had the numbers in front of me, but from 1 year, let's say a field surgery, we can have up to several thousand surgeries in 1 year, not to include dental, optometry, and just in and out patients to it. So it ranges based off the ship. It ranges based off the country we're in, and surgeons that are able to come at that time based off of it. But we're talking a couple thousand maybe a year, depending on the events that go on and scenarios of surgeries and how we do the surgery schedules and timelines and patients. And if you open up the dental clinics and you start referring to all them, the numbers can grow if you're based off the scenario you're referring to.
Yeah, it's fascinating what you do, honestly. And so when you think about the partnership that you two have with Cisco, I guess just how's the partnership with Cisco been?
Yeah, I mean, for us, it's obviously been, talked a little bit about it inside the session. I think it speaks to the commitment and the investment that we've made as an organization, not only in the infrastructure platforms that Cisco's most known for, but also the places where they've made investments. And I mentioned it inside the session. Cisco is probably one of the few partners that we have that actually have an end-to-end solution where we could sit down with them. And even in the case of Mercy Ships as an example, we can go end to end and provide the solution without having to think about potentially another vendor to bring in. And right, it's the difference between a unified, seamless approach versus an integrated approach. Not that there's anything wrong with integrated. We've certainly done that in IT for a very, very long time.
We've lived off that, right?
Right.
Yeah.
But the fact that we have unified end to end is something that's pretty unique when you think about all the various complexities that we have with IT.
Yeah, let me ask you about that, Rob. So Cisco historically has been a very good product company, right? And but since G2 Patel took over as Chief Product Officer, he's hammered home unified, integrated, right, platform. Do you think when you look ahead, not just with what Mercy's doing, but in general with AI coming and so much infrastructure, complexity just drowning companies today, doesn't it seem like platformization almost becomes mandatory?
Yeah, and certainly we do think that things like agentic-based workflows and application and more multi-agent collaboration in the future will help solve for some of that. But the fact that Cisco's making those investments now, some of the announcements they made around, the various different agent assistants that they're putting out. We have our own agent studio that we built out in terms of a collaboration workspace. So for us to be able to get MCP access is going to be pretty cool, just to see what sort of additional insights we can get.
Yeah, well, as a former IT pro myself, it's a whole different world. Yeah. So I couldn't imagine talking to my machines before, asking my router what's keeping you up at night, right? So yeah. All right, so what's next for the partnership for the two of you?
For us, like I spoke in there, we're building our third vessel. So Africa Mercy 2, we're currently starting the steel cutting, and I think for us, the partnership with them is to kind of replicate what we've done before. Over the last 10 years, they've been our helping hand in designing and bringing modern hospital vessels to the world. And I think that partnership continue to do that for our next vessel and moving forward into other technologies and things and how we provide for our not only our surgical output to the patients, but to our education and training program we have that we can provide to our local healthcare providers in the country and to bring them new skills, new technology there. I think that partnership and how we're going to transition that forward is really key, and I think that's what's the future for us.
Yeah. And Rob, I'll give you last question. Obviously, being CTO of Presidio, your job's pretty broad. There's not a company I talk to that's not concerned about modernizing their infrastructure. Obviously, AI is having a big impact. Just what advice you give people as they head down this path? Because you tell someone to modernize their infrastructure, that is like an overwhelming task, right?
It is.
So how do you simplify that?
I think the first thing to say that is, one, there's no such thing as a reference architecture anymore when you think about how fast everything's changing, especially in the accelerated compute and the AI world. And so the focus should be much more around, how rapidly can I get things done based on iteration. It's okay to fail. I think we as technologists, we forget that. Because we've been trained to, you get all the requirements up front and you have to make this thing solid, rock solid. The reality is like the technology has changed enough where iteration, failing fast, and having that additional abstraction layer that AI is starting to provide us is going to be a way for us to be able to move faster. So take advantage of the tech. The other thing is you got to get literate. You just use it. If all of your IT technologists don't have access to these tools, even if it's purely play, you're doing your teams a disservice.
Yeah, I've used the analogy that G2 did the session before you, and I've used the same analogy as him. Is you wouldn't hire an accountant that doesn't know how to use Excel, right? You wouldn't hire a developer that doesn't know how to use modern and still coding on command line. You're not going to really be able to work in the workplace unless you know how to use AI, right? So
yeah, and don't associate what you're seeing with AI with just automation.
Yeah.
It's I saw last year at HIMSS a session and it said something to the effect of RPA is dead, long live agents. And the idea is that the promise of what RPA was supposed to bring, we do think it will be fulfilled by agents. And so that whole agentic framework, this era, you're going to see not only a ton of possibility, but a lot of increased adoption.
All right, well, you have a great, tough job ahead of you. You've got a tougher job ahead of you, I think, as CTO of Presidio. But in all sincerity, thank you for what you do.
Yeah.
If it weren't for people like you that are willing to put the hard work in, the world 100%. Would be a much different place. So thanks.
Appreciate that.
Yeah.
Thank you all.
Anything else you want to add?
No, all good.
All right,
Thank
so on
you.
behalf of Rob Kim from Presidio, Grady Nichols from Mercy Ships, I'm Zeus Kerravala from ZK Research, and thanks for watching. Give us a like and also hit that subscribe button. I'll see you next time on the next episode of Zcast.